Okay, so Thomas, welcome to Shockwave Guru, and we're doing our very first video where it's going to work like a webinar, but people can download it over and over again whenever they want and watch it. And we're using you as our first one so we can pick your brains on all things Shockwave, but in particular, I think with facet joints, lumbar spine, and your specialism in neurology. So if I just take a moment just to explain to everyone that perhaps doesn't know who you are, although I'm sure there's down to one or two people in the world. Thomas Nedelka is a neurologist from Prague in the Czech Republic, a board member of the International Society of Medical Shockwave Treatments, and I believe in 2021 you become president. Is that right?
Yeah, that's right. I hope that we will meet in Prague in 2021 Congress, because this is what is the presidency about. So everybody's welcome, and also best regards to everybody who is watching this video at Shockwave Guru.
Fantastic. So what we're doing here is it's a site that's been engineered to bring the very best in talent to the Shockwave fans around the world. So our aim is to develop knowledge, understanding of the clinical use of shockwave therapy, specifically in the world of musculoskeletal medicine, but we may widen that out, so we look at urology and neurology as that grows as well. And every episode I want to have a special guest, and you are indeed the #1 and most special guest. So tell us a little bit about your journey into using shockwave.
Well, first of all, thank you for your invitation. I'm very glad that I'm #1 in the list of the specialists. My journey in Shockwave began around 2006. That means 13 years ago, when we bought the first device from that times in our country not so known company stores. And it was the first our Radial equipment. It was Storage Masterfuls, and we began with treatment of musculoskeletal pathologies and mainly tendinopathies. But basically, as you told, my basic orientation is on neurology. I'm a consulting neurologist and sports and rehabilitation medicine doctor. So I wanted to try this method, which I found very effective in various tendon diseases. And I've tried it on different, let's say, more neurological related things like on peripheral nerves. And as you mentioned, the 2014 paper on facet joints, we also put the shockwave treatment on the facet joints, because it's known that the joints are also well, or it's a good target for the shockwaves, and bone marrow edema, which is present in the facet joint pain, is also a primary objective for the shockwave treatment. So that was the reason why we went this road.
And that study in 2014, my favourite of all, as you know, we discussed this at length before, that used radial shockwave, and a lot of the information coming out these days is all about, if you're going to work on bone, maybe you need to use focus shockwave. Have you done any studies using focus shockwave on the spine?
Well, we began with a radial device. This was the purpose for this study. And we found that it's effective in the facet joint pain. We compared it to the facet joint injection and also radiofrequency treatment, both invasive methods. And we tried something non-invasive, because when you've got a spinal instability in lumbar region, usually you cannot differentiate via the injections or radiofrequency the nerves, which are very important for the innervation of multifidus muscle. And we know that multifidus are part of the deep stabilizing system of the spine. So the injection is or the radiofrequency are sometimes a problem, and not only in the spine instability. So we tried the radial shockwaves first, but now we've got a perfect result on 96 patients or 98 patients, even with the focal device, and found it more effective on neuropathic pain and also on bone marrow edema. we have a very big sample with MRI follow-up showing that the shock waves are effective even on those, let's say, findings which contribute mainly to the use of the focal device, which is better for treatment of bone marrow edema as well as the deeper structures.
Yeah, brilliant. Oh, I think it's fantastic. So obviously we've answered why you thought about doing that research, and I think that's good. So and this sounds like a development of the idea then using focus and the like. Is it something that you use in your clinic on a kind of week by week basis?
Well, we usually use it on daily basis because we have a status of pain center, and in our country we can combine different treatment options. We can use pharmacological, interventional treatment, physiotherapy, but in certain diagnoses, like the facet joint pain, we found that the shock waves are the most effective at all. So we don't have a need to combine it with huge pharmacological support, painkillers, opioids, or something. We are just seeing good results outcoming from that, and this is very important.
Yeah, I mean that'll be music to everyone's ears, because there's a big move away from using drugs just to dampen down pain. We have side effects, people struggle to drive, and all the rest of it. So I think that's fantastic.
Yeah.
So what research are you working on at the moment then? Do you have any research in the pipeline?
Definitely. Currently, we have published the first Czech book or the chapter in a book which is oriented only on the extracorporeal shockwave therapy, on radial and the focal part as well. And now we are oriented mainly on the peripheral nerves. So we have conducted the research on ulnar nerve. We have also published it in the local literature, and now together with other specialists from Germany, we want to publish this study in the peer-reviewed journal, because when you are not seen in the peer-reviewed journal, you got a big problem to have a good level of evidence outcoming from your work. So this is our primary aim.
And you've got a dog barking there, barking in Czech, I believe.
Yeah, barking in Czech, and maybe producing the shockwaves.
Yeah. Who knows?
Yeah.
So, what will you seek to change then when you take over as the International Society of Medical Shockwave Treatment President in 2021?
Well, it's a very hard question, because the ISMST, the society, our actual society, is very well established and it's open. But I think that it will be better to spread the idea into the different fields of and the other medical branches, and I think that it will be great to more communicate on the musculoskeletal and muscle and tendon indications, and the others, for example, the low back pain, even with you as far as physiotherapists, which is a big issue for future, because we have to be multidisciplinary. And from my point of view, except some, let's say, very expert indications, the shockwave therapy has to be well established. And if the people and the other medical professionals cooperate, it's a very important issue also for future. It comes from the fact that I also teach at the physiotherapy university here, which is under the Czech Technical University. There's a big department with more than 260 students. And what I teach them during the first lesson is that the multidisciplinary approach is very important. So that's maybe the starting point for my 2021 presidency.
Yeah, I mean, having attended in Beijing, I heard from a couple of people. They said, "Oh, it's very much professors, doctors, consultants, surgeons." and as a physio, you might find it a different. I don't know exactly what they're implying, but maybe I wouldn't feel as involved. And that was the absolute opposite of what I found. Everyone was so welcoming. You refer to it as a Shockwave family. I can't rate it highly enough. My experience there in China was second to none. We've subsequently presented together in Colombia just a week or so ago. And I, as a physio, feel very much part of it. And I'd like to welcome many, many more physios to come along. And actually, when we're in Beijing, there was quite a large number there, both from China and around the world. Met people from Australia and Europe and all over the place. And it was really interesting to see the integration of that. And I think it'd be a great thing from us allied healthcare professionals to see what happened in Beijing over the next few years to really be a platform to move forward. So I think we'd all welcome that really, really well.
Yeah, I think that the society global made a very huge step because it has opened up a bit. Because 10 years ago it was just a domain of orthopedic surgeon, and when I remember, it was very hard to penetrate even from other medical specialties like neurology, sports medicine, or from the position of rehabilitation doctor. And I think that everything is moving forward, and they are perfect people, great friends in the board, and I think that they will definitely stay open-minded.
Yeah, the board's great. I mean, I like them all immensely, having met just about everyone at least twice now. And they're all really welcoming. They're all really sharing of information, and certainly I've been able to come back to the UK with that information. It's shaped the way that I teach. It's shaped my methodologies. I'm now really kind of looking at the ISMST. I'm accredited by them as a practitioner, and that really means something. I've a possibly even more difficult question to ask you, and it's really simple and really short. If you could only have one machine, do you have radial or do you have focused?
So, in which will I decide to go?
Yeah, which would you have if you could only have one?
Yeah. Regardless the origin of pathology, I will definitely stay on the focus side because, from my point of view, according to my experience, I usually use the radial as a, let's say, post-focus treatment. It's not the single treatment, and I don't use the radial treatment as a single method only, and for a couple of years. And the good reason for me why I prefer the focal shock waves is that they are better, from my point of view, in almost every kind of diagnosis. Even if you got trigger point, you are able to, if you, of course, calculate the depth of the trigger well, and when you perform the good diagnostic, which is essential for your success in shockwave treatment. But I will definitely prefer the focus therapy because we can be more, let's say, surgically better, and we are exactly at the spot. From the physical basis of the radial treatment, it's better, of course, for the superficial structures, but I'm trying usually to target more deep structures. For example, in spine, I didn't have so good results, even if I published a study on radial device. The problem was that I have treated a lot of patients with the radial device before, and I had to finish the study. But when we compare the new data from the focus device and the radial device, there's definitely a superior position of the focal device against the radial. From my point of view, it makes sense that focus therapy is better than the radial one.
Yeah, there was a discussion, or I don't know how it came to light, but there was a discussion in Beijing about the fact that at one of these meetings, it might have been Beijing, they asked people how long they'd been using Shockwave and which of the two modalities they used. And people that within the first 2 years of their Shockwave journey, 90% of those used a radial device, and people have been using it for 2 years and upwards. It flipped, and actually 80 to 90% then were using a focus Shockwave. When I teach in the UK, I say, look, a really good route is to have a radial device for 1 to 2 years, use it, get used to it, but then quite quickly you'll really want to move on to the extra indications. Now, the UK is one of the countries where allied healthcare professionals can actually use focus, but in a lot of other countries, that is, physios and the like are not allowed to use it. So I don't know what you think about that, and whether it's something that we should bring to the UK, or whether other countries that refuse it should open up their doors, or not wanting to lead the answer, but it's my honest held belief that it should be a training status, that you've actually been certified to use it on certain indications, and then provided you have a medical qualification, be it allied healthcare or doctor or professor or surgeon, everyone should really be in a position where they've shown that they've got the safe use of the machine.
Yeah. We also began our journey with the radial device, and we then had a very good reason to buy and work more with the focal one.
Yeah.
From my point of view, the best reason for that was that there were definitely not only the results from studies, but everything depends on good clinical experience. And from my point of view, is the point is that even if you use, let's say, nano energetic profile on the Shockwave device of the focused one, if you use 0.05 millijoules per square millimeters or so, you know what you treat. Usually, I perform the ultrasound examination before I treat with the shockwaves. I'm able to look dynamically into the structure, because ultrasound is very good in the dynamic examination, which is not possible, for example, in MRI. And that's a good reason even to perform and combine the clinical, let's say, ultrasound or other imaging examination, and then the surgical precision of the focal treatment. That's my point of view, that I want to treat the structures which are involved in the pathophysiology of the painful process.
Yeah, very good. And so you've had Shockwave for all this time now, so many years, and you've used it. You've become one of the names in the academic world. You're going to be the president of the ISMST in a couple of years, really rising to the top of the Shockwave world. Where do you think it's going to be clinically or in medical circles by, let's say, 2025?
I think that there's a good point in past couple of years that everything is circling around mechanotransduction. I think that we are dealing with conversion of mechanical energy into the biological process. So I think that the future of the shock waves are, let's say, in two parts. The first is more precise information on the established diagnosis, and the other parts are, let's say, experimental things, which we know that in experimental animals or in the lab model works well, but it's somehow limited in the patients, like peripheral nerves issues and so on. But I think that regarding this basic thing, that we deal with the mechanical energy and we convert it to cascade of biological processes. I think that this is the future, because we can not provide only the symptomatic treatment. We wouldn't treat the symptoms at all. We have to go to the origin, to the basic part of the program. And I think that this is the reason for the spread of the shockwave therapy to other disciplines of medicine, physiotherapy, sports medicine, and so on. From my point of view, very important thing is, and I think that you probably know it as well from your work with sportsmen, that we can use it even when we want to see better results from the athletes, like a kind of conditioning or preconditioning of the athletes. And I think that there's also a future for this method, which is quite well established in the sports teams and Olympic teams as well, to be more preventive than just curative.
Yeah, preventive and performance. So, if you could work with a sports team and say they were going to lose so many days through injury each year, I mean, even from a financial perspective, that's huge for some of the real top teams. So, last serious question, and then one just to end on a lighter note. What's your chosen protocol for the use of Shockwave? Do you have something that's fixed, or is it indication dependent or patient dependent? How do you use it?
My protocol cannot be fixed because every of my patients is not fixed at all. So my protocol is very dynamic, and as I'm presenting, and I think that you've also seen it in my presentations, that I'm trying to figure out the basic problem. The basic problem is not the painful spot, but we have to look more at the patient and try to influence also the distance structures. There are a lot of chain trigger points, spasms. We see the different types of overloading in every person. So I think that the number of shocks, frequency, and also the dosage of the shockwave treatment is definitely depending on that. Usually, I don't use less than 600 shocks per one structure. I usually use 2 to 3,000 shocks, but it differs from the area of application, and the energy are very dependent on the tolerance of the patient. Because from my point of view, the clinical focusing to the painful spot and also tolerance and compliance of the patient for future is very important. So I usually begin the protocol with the lowest energy possible, then and higher frequencies. I think that there's no big difference from the procedure which, for example, you use as well. And then I improve and I adjust the treatment energy, frequency, and the other parameters according to the patient. So let's say for the study purposes, we usually have to use the fixed protocols, but in the daily practice, I usually adjust it very precisely to the needs of every patient.
Yeah, and I think we've managed to strike a chord on this, and it seems to be the way that a lot of people are moving. We're gonna do one of these with Carsten Knobloch shortly, and I think we're all in agreement. He likes this nanotherapy, really, really low energy, and it goes against this view that some people have still in the industry, which is you have to put maximum energy in, and the person's in loads of pain. And I just wonder what that does to their stress hormone, and whether that actually is having a counter effect on their tissues. But it's really good. Thomas, I've got one question I want to ask all my guests, and so we need to try and keep it a surprise from them somehow. But it comes down to understanding a bit more about the person behind the Shockwave brain. And you are one of the people that I've met that has the most incredible brain in terms of your general knowledge. I'm slightly spooked by how much you know about everything. I could bring up any subject, so I think this will be no difference. But before we do that, I did promise to mention you are available also on Spotify, I believe. Tell us about your group name.
Yeah, I think that you just overshoot with the fact that my knowledge is so huge. Maybe I'm a bit autistic. However, we have a band which is playing the combination of rock and Celtic music. And I personally play the bagpipes, so the Scottish ones. I play it in the slightly different style, which I taught in France, in Brittany, where they also play this kind of instrument. I play also other different kind of woodwinds and so on. So if anybody wants to listen to us, it's possible because we are on Spotify, as you mentioned. I think that you may put the label of our group because I don't want to spell it right now. Maybe you will just put it into the discussion and
how do you
everybody
pronounce it?
finds it out.
Yeah, how do you
And for
pronounce
me,
it?
the music and sports and also the other things, you know, and I don't want to speak about them publicly.
Yeah.
These are the perfect methods of relaxation, and everybody of us which are and we are very busy. You are also very busy as well. You travel all around the world with your experience as well in the shockwaves. So we need a good wealth of where the negative energy is put, because it's known that in our daily practice we are soaked with the let's say emotions and those negative feelings outcoming from patient, and we have to make a proper ventilation of our brains. So that's why I perform the music.
And you know, it's really good. And I've seen some videos of you in action. I've never seen you live, and that's on my bucket list. Which brings me to your bucket list. What would be? This is a question we're going to ask everyone. What would be the one thing? Is it skydiving, bungee jumping? Do you want to swim with sharks, whales? What would be the one thing on your bucket list that Thomas Nedelka from Prague really wants to do?
Okay, I have to think about it a bit, but well, I think that what will be on my wish list for future is maybe to play with my band at Wembley Stadium.
Perfect. That's perfect.
No,
I'll see if I can make that happen.
well, but we cannot do it anymore with Freddie Mercury, which is my favorite concert. I'm coming from that.
Yeah.
But yeah, some big thing. But I will stay with my feet on ground, and if everything will be okay in 2021, you will see us on stage with Carlos Leal and maybe the others performing the Shockwave band. And I'm pretty sure that we can make it if we'll be very lucky. We can make it with our Shockwave band to Wembley.
Well, if there's ever a reason to turn up in Prague in 2021 to the ISMST, then you just nailed it, because now how can anyone miss that one-time event, especially with Carlos Leal being on stage with you? That would be fantastic.
Yeah.
Thomas, I know you're very busy, and Prague looks lovely today, by the way. I love the fact that you've taken the meeting outside. It's brilliant. I just want to thank you so much for taking time out of your busy schedule to help people with a greater understanding of Shockwave, which I think is much needed around the world, and I'm sure we'll get some great comments on the fantastic answers you've given. And enough people to buy tickets to go to Wembley as well.
Okay, thank you very much, Paul, and thank you also very much for your effort, because it's very important to spread the idea in a correct way, not in the experience, but also in combination of personal experience and evidence-based medicine. And I'm looking forward for our support, and maybe support also from other people who will watch this video, because it will be great that they will even watch it, because everybody who is watching those things wants to be informed and wants to be up to date. And this is the most important thing for future in every branch of medicine, physiotherapy or something.
I agree. Thomas, thank you very much. It's been a real pleasure. And there we go. I've just stopped recording.